Hello, I'm Don Walker, and I'm Communications Director for Brevard County Government. And today we are hosting our 17th update on the COVID-19 pandemic. And with me today, we have Maria Stahl, who is the Administrator for the Florida Department of Health, Brevard, and also John Scott, who is our County Emergency Management Director. They will be providing updates, and I will turn it over to Maria. Maria?
Thank you, Don. And this is Maria Stahl. I'm the administrator at the Health Department here in Brevard County. I'll give an update on our COVID-19 cases. Currently, as of today, we have 33,579 cases. That's an increase of 149 cases today. Our labs today reporting out we're at a 5.99% positivity rate overall. Since the beginning of March of 2020, we're at a 13.54% positivity rate. Unfortunately, we did add 5 new deaths today. We are up to 736 deaths. About 50% of those continue to be attributed to long-term care facilities. Our hospitals, as they have been all along, are remaining stable and there's no capacity issues at our hospitals. Switching over to the vaccine, currently there's been 79,833 doses administered in Brevard County. 42,311 of those are first doses, and we have 37,522 complete. Looking at our 2-week trend, and that's from February 10th to February 23rd, our cases have ranged between 68 and 198 cases per day, which is down a little bit. Our positivity rate has ranged from 5.42% to 8.92%, which is also down a little bit. Every day we've been under 10%. Our positivity rate over the 2 weeks has been a 6.46% positivity. So as I reported, we are trending in the right direction. However, it's not the time to let our guard down. Variants are out there. Variants can continue to form with viruses. That's what viruses do. We do have a little ways to go with our vaccines. So definitely we need to continue our mitigation measures, which is the masking, staying home if you're sick, social distancing, and hand washing. And that's the update I have, Don. Thank you.
Thank you, Maria. I should have mentioned also that we will be attempting to answer some of your questions posed to us during this event today. So if you've got questions, please feel free to post those on Facebook, and we will answer those at the end of our program. For an update on the vaccination program, I'll turn it over to John Scott with Emergency Management.
Thank you, Don. Good morning, everyone. Again, my name is John Scott. I'm the Emergency Management Director for Brevard County. I'll just build on a couple of things that Maria talked about. One, she's absolutely right. Just because we're getting more vaccines out there doesn't mean it's time to let our guard down. We want to continue to practice our good, sound mitigation measures for COVID, which is face coverings, which is social distancing and avoiding large crowds and practicing good hand hygiene. Talk a little bit about the vaccine and where we are. We continue to have our main vaccination pod at the Department of Health in Viera. They continue to do about 1,000 shots a day between first and second shots. I know that, again, to sign up for that, you will register through the state system, the state pre-registration, which is the ShareCare system. You can find that information on our website. You can find it on Facebook. You can find it on Twitter. We have about 47,000 people that are currently on that list. We continue to add people to that list every day, but we also continue to subtract people from that list as we get more and more shots out. I talk about it a lot when it comes to sort of what is the primary obstacle for more vaccines in this county, and it is a supply issue. It continues to be a supply issue. We're excited to hear that Johnson & Johnson may be coming online in the next couple of weeks. That's another provider with more shots, so we would have 3 vaccine manufacturers out producing shots. But we also know that it's going to take some time for Johnson & Johnson to ramp up, so we don't expect large changes right away. And what we continue to preach is that we're making incremental progress here. We know that we've got our federal pharmacy programs that are out there where, in addition to Publix, which we've had for a while, You can go to, there are 3 Walmarts in this county, there's 1 Sam's Club, and there's 2 Winn-Dixie's. All of that information can be found on our website. You can sign up for all of them online. Each one of them requires an appointment, and you can register on their site to do that. Earlier this week as well, the governor announced a partnership with CVS, where he will be expanding their role and getting into that pharmacy at some point. Right now, we don't have a CVS in Brevard County that is participating, but as supply increases, just like when we saw with Publix when they first came online, we expect that Brevard will be added in the near future. I don't have a timeline on when that's going to be, but again, it's all supply dependent. And I know probably the biggest thing everyone wants to talk about, everyone wants to know and hear from us is, when are we going to expand beyond the current eligible groups? And those eligible groups are those 65 and older, those who are frontline healthcare workers with direct client contact, and those residents and staff of long-term care facilities. The short answer is we follow the governor's priorities. He's the one who sets those. It's our job to implement and get shots to whatever group is eligible. We continue to focus on that. I know he's had conversations lately about when that expansion will happen and what those groups would look like. We don't have a lot of control over that. When the governor says, hey, this is the next groups that are there, great. We'll incorporate those groups into what we're doing, and we'll continue to work as hard as we can on getting shots out. That is really where we are focused at a local level, is whatever the groups that are eligible, we want to make sure we're reaching them as much as we can, as fast as we can, with whatever supply we have. We have seen our supply pick up a little bit in the last week. Not a big amount, but by about 1,000 shots, maybe 1,500 shots. So that's a good trend for us. We're hoping that continues. We'll see as we go forward. The big news, again, when we talk about this, is we continue to have the capacity to do more shots. We can expand quickly. We just need the supply. I know it's frustrating. I know there's a lot of anxiety. We hear you. We understand that. We share that frustration. We want to be able to get this out as widely as we can, as fast as we can. This is a problem the whole country is in. When it comes to limited supplies, everyone wants to get this out. Know that we will do it as fast as we can, and we just continue to ask you to hang in there with us. Please be patient and know that we are working as hard for you as we possibly can. Don?
All right, and I think it's worth reiterating, like Maria said, that there have been 79,333 people that have received the vaccine in Brevard County, and just about half of those have gotten both their first and second shots. So that's worth, so they are getting shots in arms as we get the supplies in. I also wanted to mention briefly that the county has, in the past week, started a rental assistance program that's bolstered by $18 million in federal money. And so we are taking applications for rental assistance at all 17 county libraries. And you can also find the application on the county website at www.brevardfl.gov. So if you are in need of assistance, that's a good place to go to get the paperwork going. And also, if you need other types of assistance, whether it's food stability, appliances, or what am I trying to say here? Air conditioning, things like that. You can call 211, and they will get you in the right place to get that assistance going. I will turn it over to Jesse now for any questions that we may have received today. Jesse?
Sure. So I know it's difficult to listen and type at the same time, but quite a few of the questions that we've gotten so far we've already answered during our updates. So I might kind of skip some of those, and you can go back and rewatch for the answers to your questions. But the questions that we've gotten that we haven't yet answered, I think this is going to go to John. With sites in only 4 Florida cities initially offering vaccines to teachers over 50 under the new federal program, where does that leave Brevard County teachers?
Sure, I'll answer that. So the 4 sites you're referencing are the 4 federal sites that the governor announced in a partnership with the federal government and FEMA to operate, and they're in Jacksonville, Tampa, Orlando, and Miami. With respect to teachers, we hear you. We know the level of frontline responsibility that you play for our community. Right now, you're in the exact same boat that you have been, which is, again, for Brevard County, the eligible groups are the ones I've outlined. We have not expanded beyond that. We're optimistic that, that first little expansion to federal sites could lead to more. but we will continue to wait for the governor's direction.
Awesome, thank you. John, I think, again, this is going to be you. How have the distribution issues caused by the winter storms affected the vaccine supplies in Brevard County, and are you seeing local supplies starting to increase?
Sure, so I'll answer the first part of that. So as everyone saw last week, much of the country experienced some pretty severe winter storms, which did impact deliveries to the state of Florida and to lots of places. We're fortunate here in Brevard County that we operate very much on a week-by-week planning cycle, primarily for these kinds of instances. We know that it changes very quickly. We've got to be able to adapt and adjust and overcome very quickly to keep up with it. So because we're in a week by week, we were very, very quickly and very early, once we sort of saw those issues that it looked like we would see some delays, we adjusted our plans. We adjusted how we scheduled some things so that it would have a very minimal impact on our operation. And then, so we did actually have a first shot delivery delayed by about 4 or 5 days. So what we're doing is we're rolling that into this week's operation. So this week's operation, which is a Wednesday to Tuesday week for us, we'll actually do just over 4,000 new first shots this week at the Department of Health site in Vieira. So again, because we're on a certain planning cycle, we were able to minimize the impacts and then adjust accordingly so that we continue our primary focus, which is to get shots out as fast as we can once we receive them. The second piece there, Jesse, which was about, have we seen increase? We have seen I touched on it already. We've seen a small increase in our weekly shot just this past week. We're hoping that is a trend that continues. So hopefully in 2 weeks when we're back here again, I can confirm that yes, we're seeing an increase. I remain optimistic.
Excellent. I love optimism. So a couple people came on and were asking about their specific ailments, but I've kind of like lumped it into one question here. So the executive order mentions that hospital providers may vaccinate persons they deem to be extremely vulnerable to COVID-19. Do we know what kind of conditions may be considered eligible for that?
So the best answer I can give on those, because it is so diverse, is we encourage people to work with their healthcare providers and their doctors, work through their systems, and then based on those conversations, either hopefully their healthcare system or doctor is affiliated with the hospital, but if they're not, reach out to that hospital and say, this is the conversations that we've had with our doctor. We know that hospitals were given that discretion to make those decisions on a medical case-by-case kind of basis, and that's what we want to see happen. So work with your healthcare provider.
Gotcha. And do we have any kind of information on the vaccine operations at certain entities like Publix or Walmart, and when they're getting more vaccine supplies?
So I'll answer that one as well. So we do work with our partners in that. It is a federal program. They get them straight from the federal government. So we don't have tremendous visibility on when they arrive. I know that they open appointments just like we open appointments based on the supply we get. So I know they're anxious to get more shots out as well and anxious to get more supply to do that. And I know that as soon as they get it, they're turning it around as fast as they can.
Okay, sorry, I was trying to read a question. Okay, so I don't think so. Someone was asking, can younger people sign up on the myvaccine.florida.gov? And I believe the answer is yes. You can sign up, but you're not really quite on the wait list yet.
So you can pre-register, but they're not going to call you with an appointment.
Right.
Until you're eligible.
Right. Okay. Yeah. So you can go to that website, sign up, and they will send you that information once you are eligible, your age range or what have you.
You can pre-register, absolutely. You just will not get a call.
Okay.
Or should not get a call.
Awesome.
While you're looking up the next question, Jesse, I just wanted to reiterate on Maria's behalf, if you're going to get a vaccine at the Florida Department of Health, you need to have an appointment. So please don't just show up to ask for a vaccine. You've got to be registered. They will reach out to you and schedule those appointments, but they're not taking drive-ups, nor are the hospitals taking drive-ups as well, right? You got to contact them in advance. So, just please, save yourself some trouble and time. Make sure you've been contacted by the state to get your vaccine. Otherwise, if you show up and request the vaccine, you're going to be, disappointed for the most part. So, Jesse?
Yeah. So I did have a couple of others. Someone is asking, do the 79,000 doses include those given at sites other than the health department?
Yes.
Yes, okay. And do we know what?
Not federal.
Yeah, okay.
Yeah.
I was going to say, I can take that.
Good.
Sure.
The 79,000 doses would be any doses that are distributed from the state of Florida. So the state of Florida does send some doses to Publix, so those would definitely be included. The state of Florida sent doses to Brevard Health Alliance, and they would be included. The sites that are the federal sites, which is the Walmart, the Winn-Dixie, and the Sam's, and some Publix that go directly from the federal government would not be included. However, the federal government and the state are working together to get those numbers so that they can add into those numbers. But as of right now, it's only the vaccine that is sent out from the state.
Gotcha. I think this is probably going to be our last one that I can see. What do the sites do when there's, no-shows or there's extra vaccines? I know that we've talked about this on our previous ones, but just so that we can reiterate.
Yeah, and I'll answer the same way I answered last time, is we really do not have wasted doses. And the reason we do not have wasted doses is midway through the afternoon, we stop drawing up, and we only draw up the vaccines for the number of people that are actually in line. So we don't draw up based on appointments. We draw up, in the beginning we do, but we draw up based on the people that are actually present.
Gotcha.
And just for clarification, in the beginning, as in the beginning of the day, but then
Beginning
later in
of
the
the
day,
day,
you base it
correct.
on what
Correct.
you're seeing in the parking lot.
Correct.
Okay, well, that's going to end our program today. We will be back in 2 weeks for the next update, and we appreciate you tuning in. Please remember to follow the mitigation guidelines from CDC and stay safe. Thank you.